Hello and welcome back at SECON 2018 in conversation with Dr. S Bal, who is the professor and head of nuclear medicine at AIIMS, Delhi. So yesterday, day one at SECON 2018, also we went through the role of nuclear medicine and the kind of treatments in endocrinology, and theranostics is something a very interesting area of interest for many of us out here. So let's just get straight from Dr. Bal as to what theranostics is all about and the role of same.
Yeah, I'm thankful to the organizers and the team inviting me and sharing our experience with the endocrinologist. Actually, the nuclear medicine started with endocrinology. It was in 1940s when the radioactive iodine was given first for the thyroid disorder like hyperthyroidism, and a year later on thyroid cancer. That is the birth of nuclear medicine, also starting of the theranostics.
Yeah.
Because iodine is the raw material for thyroid hormone synthesis, and body cannot recognize between a normal iodine and radioactive iodine, and it will take inside and in the thyroid cell this radioactive iodine will kill the cell, and that is the process which started in 1940s, and still this is number one modality for treatment of thyroid hyperthyroidism, including Graves' disease, multinodular toxic multinodular goiter, autonomously functioning toxic adenomas, as well as thyroid cancer. This is the best cancer that can be treated with radioactive iodine.
Sure. So what are the current advances in theranostics as far as the therapeutics and the diagnostics
Yeah,
are
all
concerned?
these years the thyroid cancer was like the prototype of targeted therapy. Now we have moved from the thyroid cancer. Apart from the thyroid cancer, we are now going to treat neuroendocrine tumors, that includes all these functioning and non-functioning gastroenteropancreatic neuroendocrine tumors like insulinoma, the gastrinomas, the neuroendocrine tumor that mid-gut carcinoids that metastatize to the liver or many part of the body that cannot be treated by any other methods of treatment. So you first in theranostic principle is you see the target and hit it. You don't shoot in the dark. So that's what is theranostic. So first we put a diagnostic imaging agent and see whether the tumor has expressed that particular receptor. And if the tumor overexpresses the receptor, then we put a nuclear missile to it and then hit it. That is called theranostics. So you see and hit.
So what are the new challenges in nuclear medicine with the latest trends concerned?
So when India is thinking of putting the proton beam therapy, which cost around 300 crores of rupees, which has got radiation weighting factor of only 2. If you are treating with beta particles or like iodine, or you are treating with cobalt, which is a gamma ray, which has got radiation weighting factor, tissue damage is 1, the proton gives 2, whereas alpha therapy, which now nuclear medicine is using, has a weighting factor of 20, is almost 20 times more effective. So the only challenge is that we have plenty of thorium in our stockpile from the nuclear fuel cycle, but to convert the thorium into actinium-225 or radium-223 is not possible in India, and now only it is available from Europe, and some of the American companies are now started producing alpha therapy, and that is the future. India should at this point of time, next 5 years time, should provide the alpha therapy to the nuclear medicine physician who can treat all the cancers with the alpha therapy instead of using beta.
Yeah, sure. Thank you so much, Dr. Balan. Before we conclude, one last quick giveaway message for our lovely audience watching us.
Yeah, the endocrinology and nuclear medicine are a joint branch. There is no partition. Rather, every Wednesday at All India Institute, we have a integrated meeting with nuclear medicine and endocrinology, radiology and surgeons, and that is how the branches should grow. They face clinical challenges, we face imaging challenges, and we have to sit together and try to work out a common protocol and a common method. I think this will be good for the patients. At the end of the day, we are all for patient. We are not for a particular turf war. It's all for the patient.
Yeah, sure. Thank you so much, Dr. Bal, for joining in conversation with us here on ESI TV. Thank you.
Thank you.